It's important to say that overdentures are pretty well indicated for the bottom jaw. I don't think they're indicated for the top part. Snap-on dentures at the top, I think it's still better to cover the palate. Covering the palate like a normal denture, then you have more function problems like chewing,
tasting your food
taste problems, more uncomfortable,
more gag reflex.
So if we're looking to do a perfect overdenture, I think there's no benefit in doing an overdenture with palate and a big bar with all that money spending. We can give the patient a fixed solution.
And say that cross-arch stabilization with that bar connecting all the implants is probably a big reason why the implants are experiencing less stress. Locators are way more common nowadays, right?
We don't know exactly why it happens, but it happens. The good thing at the bottom teeth, we've seen that we place 2 implants here at the front bone with locators. We don't need to splint with a bar, and the results are really good. Patients are happy. Those implants don't lose bone. The only patients that go from fixed to overdenture, at least in my experience, are the ones that for any reason they lose implants. And then let's say 3 implants. At that point, if the patient doesn't want to get more implants, we do the best that we can. But that's when things go south. Sometimes they do. And I think it's important to understand that those snap-on dentures are completely different scenarios in the top and in the bottom. It's a completely different story.
Right.
I think it's a good solution for the bottom, but for the top, unless it's a very specific case of lacking lip support, because there's dentists out there that do a lot of overdentures, justifying that patient wanted lip support. But I'm shocked because most of my patients, they don't complain about lack of lip support. Some of them do. Lack of lip support meaning that the lip is goes in. You know what I mean?
It's always the female patients because they always want the pouty lips.
Yeah. But what is better, fixed teeth with some fillers or removable teeth but no fillers? You know what I mean? We're talking about this patient. If he wanted an overdenture, for me to do an overdenture on him, I would ask you to place 4 implants. I would want to do a bar. We would have to cut bone. So if we don't have bone and then we're cutting more bone, we're going to place the implants. It makes no sense.